Hi, everyone. I'm Mick Falkel, Chief Medical Officer at On Pharma. And today I'm excited to have Bill Yant on the phone. Bill is a close friend of mine. We met about 5 years ago through our lecturing on Onset, and we've become close friends. And I would call Bill a super dentist. He's a guy who is not only an early adopter, but he knows as much about the specialty items he treats as any specialist. Saying that, what we've been talking about is infection control in the new normal. So I wanted to bring Bill in on the conversation because he's an expert at everything he does. So with that, I want to talk about infection control, Bill. So thanks for being online. Really appreciate it. And let's talk a little bit about infection control.
I think we all entered this last 2 or 3 months kind of all blindsided, and really grateful that I have a great group of really bright friends that all make me smarter. You're one of those people, and so I've been reaching out to my peer group to figure out how we want to source infection control in the office. And my personal philosophy over this last 3 months has been to develop a program that addresses kind of the facts that we need to know about coronavirus and infection control. And those certainly are changing. Policy, which is what CDC and ADA recommend that we do. And then addressing fear. And fear is probably the most important part. Fear is the part fear of our employees coming back to work to make sure that they're safe and their families are going to be safe, and also fear of our patients. Is it wise to come back for dental treatment? So we developed our infection control protocols in our system to address all three of those: fact, policy, and fear. Some of the things we've talked about together is how to manage and clean air with HEPA filters and UVC light to help clean our airspace. We've incorporated hypochlorous acid with fogging system in between patients. We're all doing hopefully the same basic things of having our patients pre-rinse with peroxide. Gowns and shields and PPE certainly have become a big part of what we've done, and maybe kind of the weak link in all of this is we all have trouble sourcing appropriate equipment. And then we kind of got lucky because the reason that we met years ago was over the use of buffering anesthetic in our office, which of all of the things that we've incorporated, from cone beams and guided surgeries and soft tissue and bone regeneration, the single thing I think our staff wouldn't let us treat our patients without would be buffered anesthetic without Onset. And that's because they see every day how valuable it is for our patients' comfort, and as it turns out, the kind of the golden gem in all of this is the time savings that we have, so that we can seat the patient in the room. We can be gowned appropriately so we're safe and our staff is safe and our patients are safe. And then we're able to complete work in quadrant dentistry before we get up to do other jobs in the office. And those other jobs would be your hygiene checks. And especially this becomes even more of a important topic with the latest CDC recommendations. And that fits that policy part of we want to be able to create an environment that minimizes the cross-contamination from one patient to the next. And that then turns into how much of our infection control equipment, our gowns, our shields, our masks, are we burning through the day? So sitting tight and doing our work and making sure our patients are comfortable is a big part of what we're doing.
Oh, that's great. Well, we call that seat, treat, and complete. And so if you can do that, you're going to burn a lot less PPE equipment. And right now we know that that's precious, not only as a commodity, it's expensive now, but also you can't even get it in a lot of instances.
Well,
and
yeah.
so
And sourcing,
the amount of dentistry you can do is based on how much PPE equipment you have. So
right.
anything you can do to conserve that, it becomes really important.
Yeah, and then and the cost, I think, is going to be alarming to a lot of dentists that have not paid attention. So at $12 to $20 is the range it costs per patient to seat a patient right now and treat them. So if you're able with buffered anesthetic with Onset to be able to seat the patient, treat them, and get up and move on to your next patient without interruption, that becomes so much more valuable to us as opposed to get the patient numb, walk away, start your work, find out the patient isn't comfortable. Then you leave the patient and go do hygiene and then redress and come back to the patient. We've eliminated that variable in our practice. And again, I feel like it was the lucky gem that we had stumbled upon 5 years ago. We didn't know how important this was going to be to us when we first met 5 years ago and started incorporating into our practice. But we feel sometimes you're smart and sometimes you just get lucky, and we just got lucky on this one because this is a big part of what we do.
Well, that's awesome. I think that if, right now it's become an extremely popular product because I think Seat, Treat, and Complete is finally, you and I have been talking about efficiency for a long time in dental practice and practicing one patient at a time and yet being very productive. A lot of dentists really couldn't get past, they have to go do all of these other things. And now you kind of have to Seat, Treat, and Complete. And because of that, Onset's really taken off. So it's very exciting. I'm so glad that we got the opportunity to meet 5 years ago and extend our friendship. And I really appreciate you being online today. And thanks for all the things you're doing for your patients, your staff, and making sure that everybody's safe.
Well, and you stay safe in sunny California. It's a drizzly day here on the East Coast today, but we're going to make the best of it. And everybody stay safe and healthy. And you need to give buffered anesthetic. You need to give Onset a try because it's going to change the way you work in such a wonderful way.
Well, that's awesome.